Watkanuradu, and welcome to the COVID-19 Task Force Daily Update. Today is Sunday, March 22nd. It is 4:30 p.m. And as every day has been so far, we have some news. And without any further ado, we'd like to introduce once again the Commissioner of Public Safety, Mr. Lloyd Phillips.
Thank you, Joe. Good afternoon, everybody. Thank you for tuning in. My part will be fairly brief, but I guess to the point, so to speak. First of all, I'm glad to say the vast majority of the community and has been following the recommendations and directives to modify or close businesses in the community and close down social gatherings, social clubs, and such. So I think that's a very positive sign that our community is coming together in this difficult time. And again, like I said several times already, we understand that it has a major impact on individuals' everyday lives. One of the weak links that we do have are people still not respecting the social distancing and keeping their distance from each other, still gathering in groups. That's something that we definitely have to be very mindful of and take appropriate measures on a personal level. There's no way that it could be managed by the task force or by the peacekeepers or anybody else, but this is some personal responsibility I think that everybody has to take very, very seriously. And Lisa Westaway is here as well, and she'll further expand upon that when she comes up. And I just like to mention, I read a quote, and I like it because it says very clearly, it says, following recommendations and directives is not a sign of weakness, it's a sign of strength, and I truly believe that. We have been assessing the ongoing developments in Canada and in Quebec, and that you may have heard that additional measures were put in place today by the Premier of Quebec, François Legault. Actually, it's measures that he's taken now, but I'm glad to say Kahnawake has been one step ahead, and many of the measures he announced today we have already been implementing in our community. We'll further assess what's out there, but at this point, there is no other additional measures have to be taken until we finish doing a full assessment of all the latest medical advice and all the recommendations from the public health and so on. The task force is meeting again tomorrow. Obviously, everything is subject to change, as we always say on all our briefings, because there is new medical information that we have to assess and to see if there's additional things that have to take place. One thing that I want to mention as well today is, although it was expected, the schools, it was announced in Quebec that the schools will be closed until May 1st. And I did speak with the Robin Delarone from the Education Center, and she quickly confirmed that the Kahnawake education system will be following suit, and they will be meeting tomorrow to find out better ways to assist students and parents during this shutdown of the schools. So they will be closed as well until at least May 1st. So that's what I have very briefly for this afternoon for you. I have Lisa Westaway ready to come in to give you some additional information. So thank you very much.
All right, thank you, Lloyd. And Lisa will be joining us in just a moment. While Lloyd was on, we did have some comments that came in. One was from our sister community in Kahnawake, and they're asking us to remind people in Kahnawake that they should be doing the same things as well, the social distancing and all of the measures. I know the Mohawk Council at Kahnawake also issued a release earlier today. So please, we're all in this together. So please follow the rules that have been put in place. They're there for all the right reasons. Once again, joining us is the Executive Director of the Kateri Memorial Hospital Centre and the official spokesperson for the KMHC, Linda Westaway.
Linda. And my other name is Lisa. No worries. So thanks for having me here again today. It's really important for us to give you this update on a daily basis because we know that you look forward to it, we know that it's a support for you, and it's really important for us to communicate this important information. Yesterday, when I sometimes go through Facebook because it gives you access to also some really important information. Of course, a reminder that you have to really follow the sites that have reliable information, and you can turn to our website for that. But there is a really, really great article that I forwarded last night that I really think is important to share with everybody who's watching today. And so I'm going to actually read some excerpts directly from this document. But what it essentially is about social isolation, and it's just a reminder, and I'll start right away with reading. So this is from an epidemiologist. His name is Jonathan Rice, and the article is called Hold the Line. And he's an infectious disease epidemiologist, and he states in his article that this is not an opinion article. These are facts based on who he is as a scientist, and therefore I'm going to read directly what he says. So I'll go right into the measures that we're implementing, all of these measures that we've put in place over the last week. With these measures, we still will see cases and deaths continue to rise globally. And I'm going to add my own 2 cents into these sentences, because just to make certain points clear. We're going to see these deaths and we're going to see these cases in our own community, not just globally, but in our community here in Kahnawake. And it's really important that when we do see these cases, that we know that social distancing measures are working. We can't all of a sudden think that because we have cases, because we have death, that our measures are not working. We may feel futile, we may feel discouraged, and this is all normal in this chaos. And this is a normal epidemic trajectory. We must stay calm. The enemy we're facing is very good at what it does. We are not failing. We have to hold the line. And that's why we continue to say how important it is to keep up with these measures. This is not my opinion. This is an unforgiving math of epidemics for which I and my colleagues have dedicated our lives to understanding with great nuance. We need to stay strong and with solidarity, knowing with absolute certainty that what you are doing is saving lives, even as people begin getting sick and dying around you. You may feel like giving in. Don't. Something that is an obvious but overlooked phenomenon is when we consider groups, families in transmission dynamics. So many of us are social distancing from our regular social groups. We're not going out as often. However, we're sticking close to family. But this next part that I'm going to read is really about what social distancing means when we're within our family group. And so while social distancing decreases contact with members of society, it increases our contacts with our family members. So in fact, you should perceive your entire family to function as a single individual unit. If one person puts themselves at risk, everyone in the unit is at risk. Seemingly small social chains get large and complex with alarming speed. If your son visits his girlfriend and you later sneak over for coffee with a neighbor, your neighbor is now connected to the infected office worker that your son's girlfriend's mother shook hands with. This sounds silly, but it's not. This is not a joke, and it's not hypothetical. And if I leave this article for a second, I'll just refer to things that I'm seeing in the community all over, where we think we're following the rules, we think we're social distancing, but in fact, the example I gave you is happening on a daily basis. Within the community, we need to stay home. We need to stay in our home. We need to constantly be 6 feet from the person we're meeting up with. So Social distancing measures, as we've said, are not about individuals. They are about societies working in unison. I promise you cannot cheat it. People are already itching to cheat on the social distancing precautions just a little play date, a haircut, picking up needless items at a store. From a transmission dynamic standpoint, this very quickly recreates a highly connected social network that undermines all of the work the community has done so far. Remember, you are working so hard. You don't want to do things that will just erase all of the work that we're doing. We need to continue to implement these measures. Just stay home, stay in Kahnawake, order in as much as possible your groceries. Where really you want to stay in your close family dynamic in order to protect those around you. So, Jonathan Smith goes on to say, my goal in writing this is to prevent communities from getting sucker punched by what the epidemiological community knows will happen in the coming weeks. It will be easy to be drawn to the idea that what we are doing isn't working and become paralyzed by fear or to cheat a little bit in the coming weeks. But if we know what to expect and we know the importance of maintaining these measures, my hope is to encourage continued community spirit, strategizing, and action to persevere in this time of uncertainty. It really can't be written any better than that, and that is the message we want to make to you today. We need to continue all of the hard work that we've been doing so that we can beat this, even though we will have positives, we will have death around us. We need to minimize that as much as possible. So I urge you to keep working. Dr. Jones wrote to me just before I came on today, so I don't have a lot of details, but what she wanted to do is provide a little bit of encouragement to say that the rates of increase in volume of positive cases in Quebec, the rate of increase is significantly lower than in the rest of Canada. So we're doing something right here. We still don't have any positive cases identified in Kahnawake. We're doing something right, but we need to continue, and we need to even tighten up our comprehension and our self-distancing, social distancing measures. Other elements, little tidbits that we have for you today that could help and make a difference is just to remember your hand washing with soap and water at all times before any activity, any change in activity, all day, all the time. Remember using basic cleaning solutions that are properly diluted, following the instructions on the bottle is really helpful and will kill the virus in your home. It's one thing that we know definitely works. Wiping down doorknobs, banisters, your phones, your toilet handles, your car door handles, your steering wheels, all of those things with the cleaning solution, basic cleaning solutions are important measures. And what are some things you can do at home? Board games, spring cleaning, FaceTiming with family members, try to find ways to stay connected without being in proximity of people, because that connection, as humans, we still need that. So it's important to find ways to stay connected. My kids we're playing crib. They modified the methods with my parents who were, at their home. They were playing on FaceTime. So find ways to stay connected as a family that work for you, and we urge you to do that, and to follow. This article, if you have a chance to read it, I'm going to put it up on the site so that you have a chance to read it yourself and reflect on your own personal ways of and measures that you've implemented in your family. Maybe look it over with your family members. Discuss ways that you can work together as a family to bring some positives into your life. We hope that for you, and we'll be seeing you again tomorrow with some new measures or some new tidbits of information. Thank you.
All right, thank you very much, Lisa. Just a couple of notes before we leave. We did get some comments in from Westaway as we were doing this live. I don't know, Lloyd, if you have anything else you need to add at the end of this, but just a couple of notes in terms of the social distancing. I have to say, because I live in an area where there's lots of traffic, lots of people walking, I did notice, my wife and I did notice lots of people who were walking in small groups of 3 or 4, but they're far apart. And that's a good thing. You will, because you don't want to be lonesome, if you're walking on the bike path, you will stop and you will pass people. And we did run into a couple of people, had nice conversations, but we had the proper distance. So that's a really good thing that we're seeing. Lots of people on the island as well. So you can binge watch TV, you can watch movies, you can play board games, you can do all of those things, but also a good chance to get some exercise, but keep a lot of space. I think hopefully after this we'll see lots of people in great shape because they're doing so much walking just to get out of the house. We'll bring back Lloyd Phillips one more time here to finish up. And again, I'll give you a couple more messages from some of the things we've seen from our people who are watching this live. Lloyd?
Thank you, Joe. Just to wrap everything up here, again, it's end of a weekend. I wouldn't know it, but certainly we've been working 7 days a week as a task force. Many people in the community have been working 7 days a week, very long hours, to make sure that we're bringing you up-to-date information, making sure we're putting out proper information and filtering some of the information to bring it to you in a clear, concise manner as possible. Because we know there's stuff all over the internet. There's news outlets, and sometimes the information is contradictory at some point. So we're trying to filter that down as much as possibly we can. I was on the radio earlier today with Java just to have a quick conversation on the measures and so on in place, and I think one of the points that we touched on is again how personal this is to everybody, and we understand that. And rest assured, everybody in this room who is involved in making decisions and making recommendations is personally invested in this community and personally impacted by the decisions. So I just want to repeat that because I think it's important for people to know that we're truly invested here, and sometimes the recommendations that we put forward and information that we share, it's meant there for a reason. It's meant for recommendations, directives, or sometimes just something for you to think about as an individual, as a community member. And I think it's important to emphasize one point that Lisa mentioned about a family working as a unit, moving forward. And if one weak link, so to speak, in that unit, it could break down the whole chain. And I think even if you take that a step further, as a community, and we've been seeing it for the most part, working together as a community, as a unit, we're having successes. We're moving forward, and we're doing our darndest to ensure that the virus has a minimal impact on our community. But we can't do it without you. So we'll keep bringing these information to you. Like I said, we received a whole pile of new information from on the medical side, which Dr. Jones is going to be assessing. The task force is meeting again tomorrow. We'll give you an update as well on any additional information, any new recommendations, or any new measures. And take care. I want to goodbye.
All right, thank you, Lloyd, and we'd like to say Kahnawake to everybody who took the time to watch today. Of course, there's lots of information with the schools being closed now all the way through until the end of April and into May. So we'll keep you up to date on those sorts of things. Again, all the stores closed, the cigarette stores. We had comments from Kahnawake asking that people in that territory as well respect all of the closures so that everybody is, doing the right thing, keeping their community safe as well as ours. Special hello to all the elders who are watching today. We know that they are. We had a couple of messages about that. So you take care. We have to take good care of you. For information, once again, we have a whole list of things here we want to make sure. You're watching this on Kahnawake 911 via Facebook. Also, it was, I believe, right now it is live on K1037. We thank the good folks over there. Check the COVID-19.kmhc.ca website for information. All of the health information is there. Also, Paul's Cable Community Channel. Now we have the daily updates on, usually within 24 hours and probably less this time because we've gotten a little more efficient there. Thank you very much to the good people helping out. Kahnawake.com, of course, has some of the information from the Mohawk Council of Kahnawake. And of course, our local media has been doing a bang-up job. But thank you, everybody, for cooperating as much as you can. Remember, you cannot stop the virus from coming, but working as a community, we can limit and manage its spread. Take care, everyone. We'll see you tomorrow.